Thank you. And
Okay, good morning, everyone. Thank you for joining us in the virtual center for our partners BiCap for their Medicare 101 presentation. And I wanted to, I'm going to just do a quick mute, Bill, so we don't have that background noise while I'm doing the announcements. I'm going to mute you and then I'll unmute you. All right. Thanks everyone for joining us. We will be recording this presentation. So if you would like to remain private, please keep your cameras off and nothing would be recorded. And we're excited that you can all join us to learn about Medicare. A few notes before we get started. This presentation is not intended for broker or agent education. Also, this presentation is proprietary and is not for distribution. If you have any questions about Medicare, then please call their intake number and we'll put that in the chat. And leave a message with your name and a good time to reach you. And we'll also include an email that you can reach VICAP at. We'll include both of those contact information in the chat. Our presenter today is Bill Vaughan. Bill is a VICAP volunteer and has been with VICAP for over 10 years. He has extensive knowledge about Medicare and experience in various settings. We'd like to take questions following his presentation, so please hold questions till the end. And please note that we do find a lot of questions are in material that Bill will address in the presentation. If you would like to send a Medicare question in the chat box, please do not type anything personal. And instead, please feel free to call the intake number or send an email. And also, as Bill is presenting, we ask that everyone remain muted throughout the presentation, just to limit background noise and disruptions. And again, if there's any technical issues or whatnot, please use that chat to message myself, Taylor at VCAA, or Jenny at VCAA. We are the Zoom experts. If you have any questions regarding VICAP and Medicare, please send a message in the chat to Bill, Mary, and Edma. Bill, Mary, and Edma are your VICAP and Medicare experts. Jenny and Taylor are your Zoom experts if you're having any technical issues. All right, with that being said, Bill, I will pass it over to you.
Great. Thank you very much. And appreciate everybody tuning in over the next hour. I hope we can give you some good ideas on how to save money and make better choices in Medicare. And if you're familiar with Medicare, I hope this can help refresh some issues a bit where you can educate others. There's a whole industry out there that tries to make Medicare so complicated. And come on, if you can figure out how to Zoom, you can figure out Medicare. And I hope you don't feel a need to pay people to navigate this system. 65 million Americans are in Medicare. If they can do it, you can do it. This is who we are, a little tiny office in your county government. And I'm one of the volunteers. There's some permanent staff to help in case you ever have a difficult problem with Medicare, which is unlikely. Our goal is to provide independent, no conflict of interest, objective advice on your Medicare choices. And that is so important because there's about 90 almost all for-profit companies trying to sell you stuff in Medicare. And for everybody they sign up, they make a lot of money. And that has led to some gross exaggerations. Some people would say maybe lies about what's in some of these different plans. So caveat emptor, these are not charities. Approach this like you're buying a used car or a house. You'd get a building inspection on a new house, right? Well, be careful when you buy these products because they've been grossly exaggerated. The Washington Post of November 7th has an article where the administration is trying to cut down on some of the exaggerated advertising. If anybody ever calls you and you haven't asked them to call you selling a Medicare product, I hope you have one of those air horns where you could blast it, because that's illegal. They should not be calling you unsolicited. And if they're violating the marketing laws, imagine the quality of the product they're trying to sell. So be suspicious, be careful. Um, these are the names of the permanent staffers in our intake line and stuff. And then good sources of information on Medicare, honest, objective sources. And the big one to me is Medicare.gov. It's very easy to use. And it's just a gold mine of stuff. You can read online or order a written copy of this publication that comes out every year and is very good. The Medicare.gov website lets you find names of doctors by your zip code, near your zip code, by specialty. It gives information on the quality of different hospitals and nursing homes and hospices in our area, and they do vary. It's good quality information. And the most important thing is, are you getting a bunch of ads? These are the mail that my wife and I have gotten over the last roughly 4 days. And please, this is the definition of junk mail. Just throw it all away. Throw it all away. The way to shop and to enroll in these different drug plans or these different managed care plans is to go to Medicare.gov, put in your zip code, and there's a little box, or a big box that says find a health or drug plan. You click on that. You can put in the prescription drugs you think you're taking in the new year, blood pressure medicines. And the different drug plans and different Medicare Advantage plans, managed care plans, will be ranked from lowest estimated total cost to highest. And you can then get detailed information side by side on these plans, and you can enroll online. So it makes all these advertisements, all this stuff you're seeing on TV, irrelevant. This is the way to shop. Go to Medicare.gov and get an honest side-by-side comparison of all these different plans. Medicare, I think you know something. You tuned in. It's going to be about $1 trillion this coming year. There's about 66 million of us, a surprising number of young people who have been disabled because of an accident or an illness. And the big difference with Medicare from what you had in your working years is that it's you and Medicare. You get a number. If you have a spouse, they get a number. You pay a premium, they pay a premium. You could join one drug plan, they could join a different one. There's no family policy, there's no group rate. It's you and Medicare. And a very, very rare chance that you might need to physically give something to a Medicare person. Don't go looking for offices. They use the Social Security offices. It saves money. So you go to a local Social Security office. Problem is they have been badly understaffed in recent years. And rather than just show up and wait all day, I'd try to make an appointment. And that appointment can be weeks out in the future. So plan ahead if you do. This is very rare, need to give something to Medicare. Today, we're going to talk about your key choices. I'm not going to talk about what kind of wheelchairs are covered and what kind aren't. The key choice that we'll stress is, should I join original, traditional, fee-for-service? I go to the doctor, she or he provides a service, Medicare and I pay the fee for service Medicare. Or do I join one of these companies like Kaiser, ARP United, or Aetna? We've got 31 choices in our county. It's almost too many choices. And do I join one of them? And these companies serve as an umbrella to provide me with my hospital, my doctor, and usually my drug services. So two different ways to get Medicare: original, traditional fee-for-service Medicare, or one of these companies like Kaiser or Humana to get my Medicare services. There's a great poem by Robert Frost: two roads diverged in a wood, and I took one. Made a big difference which road I took. Medicare has these two roads, and it makes a pretty big difference which one
There's
you
somebody talking
take.
in the background.
Which is the best deal.
And
Somebody is talking in the background.
We understand we're not able to control all the office situations.
sorry, folks,
I
there is a little
apologize
bit
for
of
the
I
background
think
noise
it's
here.
Alice.
So you've got these two roads, and that is the key decision that you have to make. You also have number two, big choice. Should I get Part B of Medicare, or should I get Part D that relates to drugs? If I have a good retirement or union or company plan, maybe I don't need to do that. And then lastly, if I go with this original, traditional fee-for-service Medicare, and I do not have a good retirement plan, should I get one of these Medigap Medicare supplement? Those are interchangeable phrases. Medigap, Medicare sup. Should I get one of those plans? And there we're going to talk about ways that you could save literally thousands of dollars over your lifetime.
Well,
The good news is if you make a bad choice, you pick a drug company that doesn't answer the phone, in the fall open enrollment period, October 15th to December 7th, Pearl Harbor Day, you can change those drug plans, or you can change those managed care plans like Kaiser and Humana. No questions asked. They can't turn you away because you've been sick and something like that. And you can change. It's your chance to get even for bad service. What you can't change, and we can soon, seniors get very confused on this issue. What we can't easily change, there is no fall open enrollment period for these Medigap Medicare supplement policies. Buying a Medigap Medicare supplement policy is pretty much a lifetime commitment for most of us. Bad news is you need to make some of these choices in a timely manner, or you could face a late enrollment penalty. And the really bad news is you need to put on your calendar, I say every October 15th, to spend 5-10 minutes on the Medicare.gov website to make sure that the plan you picked this year is still a good plan in the new year. Because, as I said at the beginning, there's about 90 for-profit plans selling you stuff. If they're losing money in Fairfax County this year, what are they going to do? They're going to change to make money in the new year. That's their job to their stockholders. That's American capitalism. And you keep your eye on these guys, because the change can really hurt. I had a case a couple years ago where a person was getting 3 medicines, 90 days supply, had joined a Part D drug plan and was getting them for $80 every 3 months, $320 a year. The plan changed. Now they sent a notice of that change. That's a very hard notice to read, and it's not fun. We put it off, and it's tough to catch the changes. This person didn't notice the change, went to the drugstore in January, and the drugs that used to cost $80, $800. And the person is stuck in that plan for the year. You can't just join these plans any old time. So keep your eye on these guys. To make choices, you need the basic lingo of Medicare. Medicare has 4 parts, and we're going to dig into each of these a little bit. A is hospitals, B is doctors, and the things doctors order, like x-rays, wheelchairs, visiting nurses. We have Part C is a technical term for these companies like Kaiser and Humana and Aetna. And Part D is the only easy one. D equals drugs. People say, whoa, where's the Medigap, Medicare Supplement part of Medicare? Very important. Those plans are not part of the federal government. They are private insurance companies regulated by our Bureau of Insurance down in Virginia, not by the feds. Yeah, 33 years ago, the feds passed some consumer protection laws, but they're not nearly as strong or as good as the ones you have in traditional Medicare. That's why you need to be careful when you buy or give up one of these policies. As I said, for most of us, a Medigap policy is a once-in-a-lifetime commitment. There are exceptions. We'll get into them, but it's, for most of us, a once-in-a-lifetime. Programs evolved. It's 58 years old. The drug benefits started only 17 years ago. The managed care stuff has become quite popular in the nation. 51% of people are now in these plans like ARP United. In Virginia, the number's much lower, but it's growing. And this is, I just want to stress this. We get a lot of people who call us if they have a problem, and they don't know which of the two roads they've picked. Know what road you're going down, original, traditional, fee for service, or one of these managed care plans. When you wake up in the ER room, that's the first question the hospital is going to ask you. What road are you, which route did you take? Because that determines payment levels and benefit levels, all kinds of things. Part A, let's dig into this a little bit. It'll feel free. We've reached the age we know there's no free lunches, right? It is a prepaid benefit. All those years you worked, you paying that Social Security tax, a little bit of that tax was moved over to the Part A Hospital Trust Fund, so that if you've worked 10 years, 40 quarters, you've earned it. You don't pay more in the way of premiums. By the way, if you didn't work 10 years, you can buy Part A, but it's like $520, $40 a month. It's an expensive benefit. It's a good benefit, covers hospital stays. And if you're in a hospital for 3 midnights, you get help with up to 100 days of skilled nursing facility care, rehabilitation in a SNF, skilled nursing facility. But look at the last paragraph. Before the Medicare kicks in, you owe a first day deductible of the average cost of a hospital stay in America, $1,632. And that works on a 60-day cycle. What do I mean? Look at this example. Say I have a heart attack talking to you guys. First day, I'd owe $1,632. The next day free, next day free. Clear up to the 60th day, pretty much free. After that, co-pays kick in. But in this example on the chart, on the day 4, I go home. And I'm out of the hospital for 60 days. Well, if I have another heart attack on that 65th day, I'd owe another deductible. And you think about it, if you had really bad luck, you could have 4 or 5 admissions, deductible admissions in a year. That's what, over $8,000 in deductibles. It's to fill financial gaps like that people who do not have a good retirement system, other insurance, like to buy these Medigap, Medicare sub policies that fill in those kind of financial gaps. Part B. Now, this is optional. You don't have to take it. You pay a monthly premium. 70% of us that premium is going to be about $174.70 in the new year. Lower income people can get help. Higher income people are asked to pay more, that we'll talk about. But it's a bargain. I mean, I know that's a lot of money, but it is a bargain. If you tried to buy this package of insurance at age 64, outside of Medicare, in the private market, it'd be over $800. So for most of us, the Treasury, our kids, the taxpayer, are paying 3/4 of the value of the product. It covers 80, even 100% of all these kind of things that doctors do and order. And we seniors worry a lot that doctors aren't seeing people on Medicare. The data is very clear they are. 90% of the nation's docs have recently seen Medicare people. The problem is, are they seeing new patients? And that can be a real hassle for finding a GP, a family doc who's taking new patients, or a dermatologist. And we got real problems in the mental health sector. I don't know if you all saw a scary story on Halloween in the Post that I picked the wrong day. I'm sorry. On November 7th. No, let's get it right. October 31st. That is Halloween, isn't it? The Post had a story about basically 50% of psychologists and psychiatrists are not participating in Medicare. They are in so much demand and they'd like to be paid more that only about half of them are in Medicare. So finding a psychiatrist can be a real hassle. The last word on this slide, the word assignment, is a technical legal word. And you should try to find the doctors who take assignment. And that means they are participating doctors. That's another technical word in Medicare, which means they accept the Medicare fee schedule as payment in full. If they are among the 2%, just 2% of the 90% who are non-participating, who don't take assignment, that means they can charge you 15% more. And what the heck? Almost all of them take assignment. Try to find those guys and women. You'd find them on the Medicare.gov website near yours by zip code. The ones you need to avoid are those who have opted out, like those 50% of psychiatrists. If they've opted out, that means you would pay the whole bill yourself because Medicare is not paying anything. So you're looking for participating doctors who accept assignment. Part D is the easy one, drugs. It's voluntary. You've got 21 choices in our county in this new year. And the premiums for these things vary enormously, from zero premium in our county to $100. But please, please promise me nobody would ever sign up for one of these plans on the basis of premiums only. That would be like buying a car on the basis of who has the cheapest tires. You want to look at the total estimated cost of the copays on the drugs they cover, on the deductibles, on the premiums. And that $100 a month plan might be the best for the pills you're taking. And the $0 plan could be horrible, could charge you an arm and a leg for the pills you need. So shop on the basis of the total cost. This started off as a really weak benefit. In fact, 17 years ago, it was very confusing. And let's move on, because the good news is that a law passed last fall has, in my opinion, transformed the drug benefit into a very strong benefit. In 2023, insulin prices come way down, vaccine coverage is improved. In 2024, once you have been prescribed about $13,000 in pills, And that would mean you have paid out of your own wallet, out of your own pocket, about $3,250. Then there's no more copays. There's no more deductibles. You're totally covered. And in 2025, that protection begins at $2,000. And I'm really excited about this change because I had a case a few years ago where a person to live had been prescribed $840,000 in prescriptions. And after about $10,000 in prescriptions, they owed 5% of the rest. Well, 5% of what? $830,000 is over $40,000 a year this person was paying to get their prescriptions. Now they'll be protected after $2,000. It really makes a world of difference for people who are seriously ill. Managed care. Part C, it's a technical term. C is the way to get your A, hospital, B, your doctor, and if you join one that covers drugs, your drug coverage under the umbrella of a company like Aetna. The legal term for these things is Medicare Advantage. Please, come on, guys. That's a marketing term. 20 years ago, people in Congress wanted more of us to join them. The previous name was kind of stupid, and they said, we'll call them Medicare Advantage. I have a friend who had a horrible experience. He calls them Medicare Disadvantage. That's a little harsh, but that was his experience. Whether they are an advantage or not will depend on you, your health, the quality of the plan you pick, your luck, a bunch of things. But don't think that they're always an advantage. They may be a disadvantage. And as I said, these things have really been growing, and they can shop each fall open enrollment period to move among these different plans or to join one for the first time. Many of them charge a premium, a monthly premium, but we have some zero premium plans in our county. And I think the average premium is about $30 a month. You do have to join Part A and B. You have to pay your Part B premiums to join one of these things. And how they work is they contract with a subset of hospitals and doctors in our county and they encourage you, they prefer that you use these preferred providers. And if you don't, you can pay more or you might pay the whole bill. And a network is a subset of the doctors in our area. I talked about that Post story where half the psychologists and psychiatrists weren't seeing Medicare people. Well, in studies show that on average, only 20% of psychiatrists within an area participate in these plans, in this network. So Medicare covers most doctors. The plans cover a subset of the doctors. And one thing you'll want to know is how healthy, how strong is that subset. The things that these plans cover are the same stuff that Medicare does, but the copays and deductibles may be different. Instead of saying paying 20% of a doctor's visit, you might be asked to pay $50 every time you go to a doctor and $80 for every time you go to a specialist. And it's what you shop for is the combination of copays and deductibles and total prices that you are most comfortable with. And what's cool is these plans in our county are all offering extra stuff that Medicare doesn't cover, like hearing aids and eyeglasses and dental work. Medicare doesn't do much in those fields. These plans sometimes do. Now, if you're joining one of these plans for the extra stuff, ask hard questions, probe. How much money can I get Whose permission? Who do I have to see? Ask hard questions, because the ads for these plans, as I said at the beginning, have been grossly exaggerated. And the government is telling people like Mr. Namath to be a little more careful in how they explain the benefits. I think many of them are still exaggerated. Be careful. In fact, these ads are so pervasive, you can't turn on TV without seeing them, can you? We should understand how these plans are paid. Medicare, the government, figures out the average cost of a person in traditional Medicare in Fairfax County. And believe it or not, it's about $10,000, rounded number. For everybody that, say, Aetna signs up, they get a capitated payment. They get $10,000 from the taxpayers to keep you healthy for that year. And the more people they sign up, the more $10,000 they get. Well, they also have to bid to serve our county. If the bid, you can see on the screen, comes in above 10,000, you would pay that extra amount in higher premiums. If the bid comes in below, they don't get to keep that, say in this example, 9,000. They don't get to keep that $1,000 as pure profit. They have to give a bunch of it back in extra stuff. And that's where this free extra stuff is coming from. And you should be asking yourself, how does a mostly for-profit, Kaiser's not for profit, but the rest pretty much are, how do they come in below the cost of traditional Medicare? Especially since they often pay their executives 10, 20 million bucks, and they pay their stockholders, and they do all this advertising. What's going on? Well, I hope we have all read that the American healthcare system is the world's most expensive by far. And any fool can find a way to save money in our healthcare system. The issue is there are good savings and there are bad savings. And I hate to say it, the good savings take some work. They are harder to achieve. Nag me to take my annual flu shot, make sure my blood sugars are under control. Those are good savings. Or there's stupid bad savings. Delaying surgery because I'd like to have my hip hurt less. Don't have many psychiatrists in my network. Those would be bad savings. And we as consumers have to find the ones that make good savings, and that is very hard to do. The government has a quality star rating system with 5 stars as tops, and it's based on hard data. It's not like Yelp, gee, I like the appetizers, they were served quickly. Yeah, it's not those personal opinions. It's hard data on error rates and wait times on the phone, that kind of thing. And the big problem with that is there's been grade creep, and all the plans in our county are way above average. The average is 4.1 stars. That's not much help. I would say, personally, I would avoid any plan, run from any plan below 4 stars. They are below average in our county. And if a plan has a 2.5 star rating for a couple of years, they throw them out. They're complete turkeys. So use the quality star system. A Medigap. This is for people who've picked original traditional Medicare. If you go with the Advantage plans, you can't be legally sold or you can't use the Advantage plans. So what the heck? But in traditional Medicare, they cover the financial gaps of A and B. Again, not C, that's Medicare Advantage, and not D. In the drug field, you're going to have copays and deductibles. The financial gaps of A and B of the things Medicare covers. Medicare doesn't do beauty treatments, so your Medigap plan isn't going to do tummy tucks. Sorry. But these are strictly the gaps in A and B of the things Medicare covers. And a comprehensive one costs about $120 a month, and they will go up as you age and with inflation. So over your lifetime, expect to be paying more and more and more if you buy one of these things. But if you're smart when you first buy one, you can save literally thousands of dollars over your lifetime that we'll talk about. And the commissions for Medicare Advantage are much bigger than they are for these gap plans. And we've had cases where people called a broker. Most brokers are wonderful, honest people. Some aren't, like any profession. We've had people who called a broker, asked to buy a gap policy, were sold into one of these Medicare Advantage plans. And then when they went to their doctor and the doctor said, I'm not in this network, you're going to owe me the whole bill. It was a terrible mess. Know what you're buying. Read the fine print. Lower income can get help. If your income's below these levels on this chart, you can get help with the copays and the deductibles. And the lower the income, the more the help. And please, a lot of people haven't signed up for help. If you ever hear somebody say, I can't afford to go to the doctor or fill this prescription because of the darn copays, have them call us. Good chance we could find some help that would make their life a little easier. And I hope you all are in this category. I wish I were. And if you are asked to pay a higher percentage of the value of the Part B and Part D drugs benefit. And here's a chart. It's hard to read, but you get the idea. If your income in 2022 was above the numbers on this chart, $206,000 for a couple, then you would pay a higher percentage of the premiums. Well, the great confusion here is, if you think about it, you can understand why. There's a 2-year lag. That by the time you earned income in 2022, you report it in the spring of 2023. The IRS says, yeah, it looks right. And they tell Social Security, and it's time to change premiums in the spring of January of 2024. There's a 2-year delay. Well, you say, that is stupid. That is crazy. I retired in 2023. My spouse died, or we got divorced. I'm not living on what you guys think I am. In that case, let me go back a slide. You can file a Form 44 if you've had a life-altering event, and they'll adjust your premiums to reflect what you are actually currently living on. That does not count, folks, cashing out a big financial asset or, selling a beach house in Ocean City for a profit. That could throw you in a much higher bracket. And therefore, this is an area where you might want to talk to your tax advisors or do some tax planning to smooth out income so that you minimize your premiums. A lot of things Medicare doesn't cover. We talked about teeth, they're called teeth, hearing aids and eyeglasses. The big one is just getting frail and old and can't get out of bed, and dementia. I'm going to speed this up a little bit. Just you need to plan for medical expenses. And as we get older, I'd love to spend everything on grandchildren and playing pickleball or cruising. You can't. You got to save for an increasing share of your budget to go to medical expenses. I've thrown a lot at you. A real quick review. A, feels free. Part A, hospital stuff. B, optional. You pay premiums, doctors and what they order. Part C is a technical term for what's legally known as Medicare Advantage, which is a way to manage care, way to get your hospital doctor and drugs. D is drugs. Medigap fills the financial gaps of what? A and B, but not C and D. Lower income get help. Higher income get less subsidy. You can look at it as a higher tax, but it's less subsidy. And a lot of stuff Medicare doesn't cover. So your first big choice, which road to go down? If you go with original, traditional Medicare, and you don't have a great retirement plan like retiring federal workers or teachers in our county, you've earned A, you'd sign up for B, you'd sign up for a D drug plan, and you'd probably get a Medigap policy to avoid those $1,632 Medicare first day deductibles. Or, and then this is a bit simpler, you could say, I'm going to have a company like Kaiser take care of all this. I'm going to join Kaiser. Now I have to be an A. I've earned A. I have to pay my Part B premiums, and I may or may not pay a premium to Kaiser, but by joining a Kaiser plan that covers drugs, I get all that care through Kaiser, and I do not bother with a Medigap or MedSup plan, okay? Can you switch roads? Yes, but I think this is the single biggest problem in Medicare, that switching between these two roads can be difficult. During the fall open enrollment period, I could go from original fee-for-service Medicare and join Aetna. And then during fall open enrollment period, I can go from Aetna to Kaiser. Or I can go back to original Medicare. But, huge but, biggest problem in Medicare, I may not be able to get back an affordable Medigap policy. Let's stress that. I'm going to stress that with another slide that says the same thing. At 65, I join traditional Medicare and I buy a Medigap policy. At 68, I've seen all these ads about getting all this dental stuff. I know I need some dental work, so what the heck? I join a managed care plan. At age 70, I'm diagnosed with a terrible disease, and there's one genius in the world at Mayo Clinic in Minnesota who can treat it. My plan doesn't cover Mayo. So I say I'm going back to original Medicare where I can go to Mayo and see this person. At that point, think about it. Would a for-profit private insurance company want to write you a Medigap policy? No. Or they charge you $1 million or not cover the body part that's in trouble. That is a problem. So that moving back and forth between these two roads is not really very easy. Capiche, everybody? There's pros and cons on Medicare Advantage. The big pro on the left side, or my left, is in fee-for-service Medicare, is 90% of the nation's docs, 99% of the nation's hospitals are open to you. Makes it real easy to travel. In big pro in managed care is they save a hunk of money, and the government says you got to give a bunch of that back in extra stuff. And these plans also do have some catastrophic protection that, and it varies how much, but in our county, somewhere between $3,000 and $8,000 that you spend on deductibles and copays. After that, you're totally protected. And in fee for service, you'd have to get a good retirement plan or a good gap policy to get that kind of protection. Managed care is good. Coordinated care can be good. If you see 4 or 5 different doctors, you could get 10 or 12 different prescriptions. Those prescriptions could interact in ways that can kill you. So having somebody keep an eye on the overall care can be a good thing. The big cons is at the first of the month, if you're healthy, the first of the month, what goes out of your checking account or your withholding is more expensive in fee for service because you're buying a Medigap policy or a company retirement plan. The big con in managed care is really the bottom line on this page is skimping on care. There's a bunch of studies by people not trying to sell us stuff that as we get older and we get sicker, we want to leave these plans. We try to leave these plans and we feel rationed, we feel limited, overmanaged. And as we've said, a con is after you've been in one of these plans for a year, can be very, very, very hard to get a Medigap policy if you've been sick. And again, you need to keep your eye on these guys because they change from year to year. I'm going to skip ahead this is a chart we put together. It's very rough, but if you're very healthy, you can see Medicare Advantage would be a savings. You're not spending money on a gap policy, and you're getting if you push at it, you're getting about $1,000 a year in extra stuff. If you're sick, it flips, and managed care can be much more expensive than traditional Medicare if you include in traditional Medicare a gap policy of some sort. Did you all see the story? I thought it was so cool. The lady, 104-year-old lady who had gone skydiving. What an active, wonderful person she must have been. But in the next week, she died in her sleep. A healthy person like that would probably be, I hope she had joined a Medicare Advantage because she would have saved money and had insurance all those years. If that's not in your gene pool, then yeah, you may want to do original fee for service because we don't all go skydiving at 104, do we? If you decide to join managed care, pick one that covers drugs. If you care about a particular doctor, check with that doctor's office. Don't believe the websites. They are way out of date. Go with a higher quality star. And if you're picking one of these plans for the extra benefits, probe on what you're really getting, how much extra benefit. Part B. There's four. No, how about three? There are 3 common scenarios for picking Part B. You turn 65 and you don't have good health insurance, or you have very, very expensive private insurance. Join Part B in the 3 months before your birthday, your birth month, or the 3 months after. Or if you're uninsured for a year, you face a late enrollment penalty in Part B that can be mounts up, is very expensive after a couple of years. Or I think this is where most of us are, special enrollment period. You are covered because you or your spouse is actively working. Now, this is not a retirement plan. This is not COBRA insurance. You are active, or spouse are actively working. You have health insurance because you go to work, and you're in a larger company. Smaller companies, you probably need to join Part B. You could delay enrolling in Part B and not pay that Part B premium. And once you finally quit work, you could be 90 years old. You finally quit work. You say, I want coverage now. As long as you join within 8 months, no late enrollment penalty. Don't ever let there be more than a 2-month break in good drug coverage. We'll come back to that point. But no late enrollment penalty as long as you're under Part B within 8 months of leaving active work. Or you have a great retirement plan and say, heck, I don't need Part B. Okay, just be sure that the company you're working for never ever goes bankrupt during your lifetime, or you could face a late enrollment penalty when you try to get health insurance at an age 90. I'm assuming maybe there's 1 or 2 federal retirees on the line. I'd like to plug Washington Consumer Checkbook. It's a local kind of Consumer Reports magazine. And they come up with a yearly publication. I think the 2024 is just out. Guide to Health Plans for Federal Employees. And there's a wonderful chapter in here for retirees on the strong pros and cons of getting Part B. And take a look at it, retiring feds. Could save you some money. And last paragraph on this slide, you may be in a retirement company, union plan, where you're paying. I had a person call me who was paying $1,400 a month. And come on, you can get really good Medicare coverage for $300-ish a month. You can buy vision and dental insurance, say another $100. For $400 a month, you get great coverage. Why are you giving your old boss $1,400? Think about it. Talk to your HR departments. Anybody have health savings accounts? Read the IRS warnings very carefully. And call us if you are using COBRA. There's a technical problem with COBRA insurance. Part D coverage. Future of healthcare is clearly in these amazingly wonderful, but also amazingly expensive drugs. And if you don't have what's called creditable, it's a legal term. Every August, September, your company union plan will tell you whether it's creditable coverage or not. And that means it's as good as or better than the standard drug package described in the Part D Medicare law. So if you have something as good or better than Medicare, what the heck? No sense joining a Part D plan. If you don't have credible coverage, get it, or you start to face a late enrollment penalty. Now, if we get a lot of people call or say, well, you know, I take one generic and I can get it from Walmart for $5. Why do I fuss with all this hassle? Hey guys, there's a $0 plan in our county in the new year. By joining it or the $5 plan, you can prevent the late enrollment penalty from happening, and you have insurance. You don't know what's going to happen in the middle of the year. You might need tens of thousands of pills, and you would at least have basic insurance. And if it's not a perfect plan, you can change in the fall enrollment period to get a better plan. Or on the other side of this chart, if you take lots of pills, well, where do you go? Medicare.gov, put in your zip code, put in the pills you're going to take, and the plans will be ranked lowest cost to highest. I'd look for higher quality stars. Oh, hey, and that website will let you test 5 different kinds of drugstores near your house. Play with that a little bit, because you can save a hunk of money by looking at the best drugstore to go to. Check out mail order. You might save money. Check out one of the box stores like Giant Pharmacy or Walmart. They can be big savings compared to the more retail drugstores. And you can enroll online. The key issue is, are all the pills you care about on the formulary? Another technical word, formulary, the list of pills that that company will cover. And you can enroll online. Piece of cake. I went the wrong direction. Let's go back. Okay. Shop each year. You can save money. And Medigap. This is for people in original Medicare. And what happened 30 plus years ago, there was a lot of fraud in this sector, and people were being confused by all this advertising that they're of the different plans that covered different things, lots of ticky, stupid little differences. And Congress said, hey, companies, you got to standardize your products so that people can shop on the basis of price and not these stupid differences. So they came up, and we now basically have 8 standardized plans that you can choose among. I think most of us go with a G as in George plan. You can see it has the most check marks. The only thing not covered is an annual Part B deductible that you need to pay this coming year, $240 before Part B kicks in. But everything else is covered. And all Gs are identical. They're peas in a pod. No G offers anything more or anything less than any other. And they have nothing to do with your health. These are bill payers. They don't send visiting nurses to your house or anything. And if it's just really a function of computers and software design, go with a lower cost one. Go with a lower cost one. It's a great way to save a ton of money over your lifetime. And the key to buying one of these is, particularly if you're over 65, and in the first 6 months, 1, 2, 3, 4, 5, 6, in the first 6 months that you join Part B, all 50 companies selling these things in the state of Virginia have to offer you all their products with no medical underwriting. They can't say, hey, you've had cancer, or hey, you've got early onset Parkinson's. They can't turn you away or charge you more. And that is your kind of one. There's exceptions, if the company goes out of business, or there's exceptions. But for most of us, this is your one best chance to get these policies. And the shopping is super easy. You go to the website of our Bureau of Insurance in Richmond, and that's SCC, State Corporation Commission. So scc.virginia spelled out .gov. There's a page that'll come up, consumers. Click on that. Click on a page that talks about insurance, and there you'll see a link to comparing Medigap prices. And you put in your zip code, you put in your age, you put in the model number you want, let's say G, and it'll give you prices, plus their recent rate history, how they've changed in price. Get a feel for what you need to expect in terms of inflation, and gives you the contact for these companies. So again, forget all the mail, forget all the ads. This is the way to shop for a Medigap policy. Enrolling in Part B, if you're drawing early Social Security, the government will send you a card, a Medicare card, that you're in A and B. You can decline B if you don't want to start B at that age. There's an initial period that we talked about, signing up around your birthday if you don't have good insurance. There's a general enrollment period, January, February, March of each year. treat this kind of seriously. If you're not careful, you could be a gap of a few months when Part B is available to you. And that'd be the month I would have been hit by a bus. So be careful. And again, this one that most of us are interested in, the special enrollment period. You have doctor coverage because you're actively working or your spouse is. Join within 8 months of leaving that active work. And the stuff in bluish purple on the bottom is just telling you that you're going to need to get a form from your HR department that you can tell Social Security, hey, I've had health insurance. A late enrollment penalty does not apply to me. And you're just going to have to prove you've had health coverage. And we've run a little over an hour, so let's quit there and see if there's questions. I would urge all of you to help us fight fraud. You'll get a statement from Medicare every 3 months of all the bills paid under your name and number. Check that. And if you see something, I know I never had my foot amputated for $10,000, report it. There may even be some rewards for certain kinds of fraud reporting, but it keeps our premiums lower and our taxes lower. So why don't we move to questions?
I'm going to stop the recording before we get into those questions.